So a stent is placed inside a coronary artery to treat a blockage in the coronary artery. A stent is an invasive procedure. It is not surgery. A stent is placed by an interventional cardiologist. Usually we use stents if there's 1 or 2 blockages in safe areas for a stent. If there's 3, 4, 5 blockages, they send that patient for bypass surgery. Or if there's 1 or 2 blockages in critical areas or areas that are difficult to stent, then they'll send that patient for bypass surgery as well. It gets quite complex. So there are different scoring mechanisms we can use, like a Syntax score or other European type scoring mechanisms, but really comes down to a team approach of a cardiologist and cardiac surgeon working together with the patient and family to determine. It has to do with the age and comorbidities of the patient. Are they young and healthy, where they could tolerate surgery just fine? Usually surgery is a better long-term, more durable procedure than stents. But if you're older and frail, multiple medical conditions, then it might be best just to treat with a stent or 2, even though it might not be good for the long run. If that patient's older and sicker and high risk for surgery, might be the better option. So going forward, we see surgery being offered more to younger, healthier patients, usually with multiple bypasses and multiple what we call arterial bypasses, where we use the patient's own native arteries in addition to the veins, or just native arteries alone to do the bypasses because they last longer. And then we reserve stents for older, sicker patients who are not good candidates for surgery. If you have coronary artery disease and have blockages in your heart, and you're trying to figure out what's better for you, either a stent or surgery, it depends on multiple different factors. The age of the patient, the multiple medical conditions the patients may have, as well as the degree of blockages, the location of blockages, and the number of blockages. It's very important that you work together as a team with your cardiologist and with your cardiac surgeon to determine what's best for you. Stents and bypasses are similar. It depends on the location of the blockage, the type of blockage, and the runoff of how healthy is the vessel that you plug into or that you stent. If it's a healthy vessel downstream and it's just one short little area, then stents should last a very long time. Could last 8, 9, 10, 12 years. However, if there's blockages upstream and downstream from the stent, then we expect progression of disease. It may not last that long. Similar to bypass surgery, if there's one discrete blockage in a really healthy vessel downstream, then that bypass vessel should last a long time. We found that arteries last longer than veins, so we try to use arteries in every scenario we can. Hopefully, vein bypasses we expect to last anywhere 5, 10, 12 years, depending on the risk factors of the patient and the quality of the vessel we plug into and the downstream disease. Arteries, we hope, will last 20, 30 years, depending on the condition of the artery as well.